เซสชันต่อไปเป็นเซสชันที่สำคัญนะครับก็ทางวิทยากรจะมา address 2-3 key point หลักๆนะครับว่าจะเปิดโรงพยาบาลเนี่ยได้เนี่ยจะต้องทำอะไรบ้างถ้าท่านไม่ทำท่านอยากเปิดท่านจะเจออะไรนะครับเพราะฉะนั้น2อย่างก็คือกุศลและอกุศลก็ต้องไปชั่งเอาเองนะครับว่าอยากจะเปิดหรือไม่อยากเปิดขึ้นอยู่กับอะไรถ้าเปิดในกรณีที่ไม่เคยเปิดจะเจออะไรนะแล้วก็ต่อด้วยการ develop flooding protocol ซึ่งส่วนใหญ่เนี่ยมาจากประสบการณ์ของเฮอริเคนแคทรีนาแล้วก็เฮอริเคนอิงที่สหรัฐอเมริกานะครับทำให้ CDC response มาเป็นโปรโตคอลซึ่งเราสามารถเอาไป apply ใช้ได้เป็นเช็คลิสต์ธรรมดานะครับก็ขอเชิญเดฟพูดเลยครับ
Thank you. So again, I wanted to really acknowledge Dr. Mayhall and Dr. Hewlett for sort of their advice and really help in understanding how to try to put together a protocol for really recovering from catastrophic flooding. So the objectives of this talk are really to understand key aspects of planning recovery from severe floods and discuss prevention measures to limit damage from future floods because unfortunately the fact that your hospital flooded once probably means you're at risk of flooding again, and how do you prevent future floods from causing the same amount of damage. And then I think one of the things I wanted to talk about at the end was really understanding how to develop a protocol for also dealing with what I call everyday floods. And these are things that we deal with on a regular basis and can have, especially if they occur in a critical area like an OR or an ICU or a bone marrow transplant unit, can have the same potentially same problems that you would see as you would in a catastrophic flood in other areas. So I wanted to start by sharing it's not as bad of an experience as many of you have dealt with, but this was something that we dealt with last summer. So on the 26th of June, a storm dropped nearly 12 centimeters of rain in St. Louis over a 12-hour period with 112 kilometer per hour winds. So we had St. Louis doesn't get, as opposed to probably here, we don't get 12 centimeters of rain over a 12-hour period very often. And unfortunately, our sewer system, the city sewer system, was unable to handle that amount of water runoff that occurred that quickly. And as a result, our hospital suffered sewer backup and flooding. So this is a picture of a get well soon balloon that you can get at a gift shop, at a hospital gift shop. And what happened with this particular balloon was that it floated onto the roof of one of our hospital buildings and clogged the drain for the roof. And so we had about 2 feet of water accumulate on the roof, and that water had to go somewhere, and this is where it went. So this was our cafeteria, and you can see that basically we developed a waterfall in our cafeteria because of the flood. So that was our hospital's a very large hospital. It's 1,250 beds, and it extends over a U.S. city block. And we have 2 cafeterias. This was the South Campus cafeteria. And then on the North Campus, we had a sewer backup into the first floor of the North Campus. And this is the kitchen of the cafeteria, and this is the cafeteria seating area that basically had sewer water back up into it. And all of the areas that are green were affected by the backup, including our transplant clinic. So how do you deal with coming up with a protocol, and how do you deal with recovering from major flooding? And I think the important thing to remember is that many groups need to be involved in hospital post-flood planning. So this shouldn't just be you and facilities or your engineers or your maintenance people. It really needs to be a large number of people being involved and at the table. So you need your air conditioning and ventilation repair people. You need your electricians, your plumber, your carpenter, your facilities engineers. If, depending on how bad the damage was to your hospital, you may need a structural engineer to determine if the hospital building is still sound and is not in danger of collapse. You need your security. You need your people who are planning and designing and doing construction. Obviously, you need infection prevention. But so you need all of these people. And I also, this is hospital administration and finance are important in this. And then I don't know, depending on how big your hospital is or where you are, but if you do have a media relations people, it's good to have them involved too, because sometimes, especially to answer questions from the public at large. So there's a couple of things to remember that are very important in recovering from any catastrophe, but specifically catastrophic flooding. I think the first thing to acknowledge that everyone is stressed out. Not just the community itself has suffered damage. The people that work in your hospital may have lost homes or loved ones. So that's going to be an issue, and you just need to acknowledge that that's a real concern. And you need to, when you speak to individuals, you need to remember that may be something that's affecting how they behave and how their decisions are being made. The other thing is that, and I think Dr. Anucha showed this, is housing may be scarce for hospital staff. And that impacts how your hospital staff is going to show up. Are they going to be there if they're dealing with their house being flooded? There may be issues with them being absent. And the other thing is if they're, again, I don't know how relevant it is to Thailand, but in the United States, daycare is a big issue. And if a daycare is flooded, actually in our planning, one of the first things we do is try to make sure that the daycare is secure and up and running, because if our daycare is not working, then we could lose up to about 30% of our nurses because they would have to stay home. So the other thing is remembering that skilled workers are in high demand, and they also may need housing. And then the other thing that's important for the hospital, and that's why media relations may be useful. Communications and addressing rumors are very important, and it's important to make sure that you keep the nurses, the physicians, the hospital workers, basically give them updates so they're aware of what's going on, and try to address any rumors that may develop, because those could be a problem. The other thing is set timelines, but be realistic, and literally it may take years to get back to normal. So as I was saying before, the medical college, or the University of Texas medical branch at Galveston, they were closed or at limited operations for at least a year after the hurricane. And in this reference was the University of North Dakota Medical School and Medical Center suffered flooding when the levee broke in their city. It took them almost 5 years to get completely back to where they felt they were at pre-flood operations. So the other thing that's important recovering after catastrophic flooding is really prioritize what's essential for the hospital building to function. So you need electricity, you need some source of potable water that can be used, you need sanitation. So Dr. Keith talked about liquid and solid waste removal. You need an air handling system, especially for the operating rooms. And the other question is, depending on how tall your structure is, you need elevators. If you don't have functional elevators in a 5-story hospital, you can't get patients to and from their rooms on stretchers. And you should think about using all of these things to guide your recovery plan. So in terms of a flood protocol, the first thing you need is the initial safety evaluation. So this involves really looking at the structural integrity, looking at the building itself, and looking for missing parts of the building that may affect how it's functioning and whether or not it can keep water in the environment out. And then again, just like the mold that I talked about earlier today, assessing for hidden moisture, looking for electrical system damage, including any exposed high voltage, any damaged electrical insulation, and looking at the integrity of the power to your hospital, looking at the water distribution system, looking at the sewer system for the hospital, looking at the fire emergency system, so the water sprinklers, are they functional? Looking at the HVAC system, and I'll talk about that in more detail. And then medical waste and sharps disposal, which Dr. Keith talked about. So water removal, as soon as the structure is safe to enter, you need to start getting water out of the facility. And that could involve pumping out standing water, and then doing vacuum of residual wetness from the floors, carpets, and hard surfaces. And then make sure that you clean and maintain the wet vacuums after use and allow them to dry, so you're not potentially making the problem worse by having mold growth in the vacuum. And then doing really an assessment for mold and water damage, and then doing the remediation I talked about earlier. So once you've looked at the actual structure, you need to start doing an inspection of all the systems in the hospital, and either doing repair and disinfection or replacement of areas, depending on if they can be salvaged. So in terms of the HVAC system, that includes the motors that run the fans of the HVAC system, the ductwork, the filters, and the insulation. And that needs to be inspected, either disinfected, repaired, or replaced, depending on the extent of damage. The water systems, both the hot and cold water, the sewer drains, steam delivery. Dr. Keith mentioned how the steam delivery is critical, and having that in order to have the autoclaves working, chillers and boilers. Having the electrical system, that includes both wiring for sort of your more industrial equipment, and also lighting if there's patient call systems or pagers, any emergency generators or fire alarms, your communication systems, so telephones, paging systems, computers, your medical gas system, so all the hookups for oxygen, air, nitrogen, they all need to be inspected and make sure that they're functional. And then the other thing is hazardous chemical and radioactive storage. So if you have a facility that has nuclear medicine or has any sort of radiotherapeutics, those need to be secured, and you have to make sure that that's not an issue. So let's talk about the HVAC system. So just some key concepts for review. One of the main functions of the ventilation system is that air is filtered from the outside. So filtration is really measured in terms of efficiency, and it's the ability of the system to filter 0.3 micron size particles, so very small particles. And for hospitals in the US, the standard's 95% filtration. So 95% of these 3 micron particles will be captured if your HVAC system is working normally. And then air can either be recirculated or exhausted to the outside. One of the issues with open windows, though, just to be aware of, is that it may affect how the air pressure in neighboring rooms is impacted, and it may reverse airflow or reduce it. That's not so much of an issue for a lot of parts of the hospital, but for something like the OR or a protected environment like a bone marrow transplant unit, that can be a big issue. So what do you look for after flooding for a ventilation system? Really, you need to look at the hospital air handling system needs to be examined very thoroughly for mold, for debris, and for dampness. So you can get mud and basically sticks and debris into the system itself, and that can be an issue. The problem is you do not want to turn on a HVAC system that has been flooded until you've inspected it and cleaned it, because if you turn it on and there's issues with debris or mold inside the system, all you'll do is send fungal spores throughout the hospital. So you really want to try to make sure that that system is cleaned up before you start turning things on. So the experience, when I talked to Dr. Mayhall about their experience in Galveston, one of the things he commented on, and something for you to be aware of, is that just not even the hospital itself is flooded, but the surrounding community is flooded. And so because of that, there's a lot of dust and mold spores in the outside air around the hospital. And that's what he saw after Hurricane Ike. And they actually had to switch to even higher efficiency air filters. They had to switch to 1 micron sized air filters to try to keep the amount of debris and mold spores out of the hospital. The other thing is because the air was so dirty and so had so much debris in it and dust, that they had to change out the filters every 2 weeks in their air handler system instead of the usual every 3 months. So it's something to be aware of when you're dealing with the HVAC system. So what about the role of air sampling after a flood? So this is done to detect both particulates of dust or spores. And you can do sampling for dust, and really what that does is it measures the efficiency of the air filters to capture dust, and you can compare it to outdoor air. So you could say dirty air is outdoor air, and clean air would be 90 to 95% filtered, and then the cleanest air is HEPA filtered, which is greater than 99.9% of those particles are cleaned out. So what about air sampling and Aspergillus? And I think we talked about this earlier this morning, and there are ways to do it, but I think it is a challenge. And I think Dr. Anucha pointed out that the drop plates don't always, there's some controversy about how effective they are. I think the problems for us is that to do air sampling other than the drop plates really requires significant laboratory support. And if you don't have access to a lab that specializes in that, then that can be a challenge. The other thing is outbreaks of Aspergillus infections have occurred at low spore levels. So there's not really a good, you'll see I give you an example of what they set as a level, but there's not really a good level in the literature that you can go upon. There's no real standard testing protocols. There's an unknown incubation period for Aspergillus, which can make it sometimes hard to figure out when the exposure occurred. There's variability of sampler readings. So if I put the air sampler at floor level versus at mouth level versus up there, I may get very different readings depending on how the airflow is in the room. And then the volume of air tested affects sensitivity. Obviously, the more air you test, the more sensitive your testing will be. So this sort of just highlights a potential problem with air sampling that you may encounter. So let's say you did construction or demolition right here, and you see this big peak in spore counts, and this is time in weeks. Then you start seeing cases and then you do your air sampling. Well, they were exposed here, and the demolition or construction ended, and then you're faced with an issue. So probably doing air sampling after the fact, you have to just be aware of that may be an issue that you see. So what about air sampling after flooding? And when can air sampling be done, and when should you think about doing it? Well, one thing would be to monitor demolition and construction sites, and it's not monitoring inside the demolition site, because you'd expect when you're tearing out moldy drywall, you're going to expect very high spore counts. Where you want to do the monitoring is in the areas outside of that demolition zone, where you want to protect patients and make sure that they're not being exposed. The other way you can do this is to assess contamination of the ventilation system in the hospital. And then again, consider in cases of outbreaks, though as I said, that may be an issue depending on when you do the sampling. So Dr. Hewlett and Mayhall had shared at the Shea meeting in 2010 their experience after Hurricane Ike. And what they did was they decided to use this as a way, very much like Dr. Anucha talked about this morning, to set up air sampling in various parts of the hospital to see could you use those results to determine when to resume patient care in various areas. So they set up air sampling in high-risk patient care areas like the ICU or the bone marrow transplant, in the ORs, in other patient areas, and in their lobby. And so they used this criteria, and this isn't based on a published guidance. This is actually based on an expert in the field that they contacted. And so they used these as a criteria, and you can see they did not drop plates, they actually did volume sampling, where they had air being sucked into an air sampler, and they got a certain volume of air tested. And you can just see how they set these criteria as sort of, this is our guidelines, these are our guide points of if it falls below that amount consistently, we can then reopen that area. Well, I think one thing that they found was that they identified issues in the operating room based on the fact that they were finding high spore counts. So they found high spore counts, and they went back and they looked at the HVAC system, and they found a couple things. So they found low airflow was detected in the OR itself due to a malfunctioning air handler. They found that there were multiple leaks in the ductwork around the air handler and the ceiling. And they found that the intake filters were loaded with debris. They also found that the terminal box, which was located between the air handler and the final filter in the building, was loaded with sludge. So, and then they found that the air exchanges per hour in the OR were not satisfactory, and they found that their exhaust fans needed to be replaced. So you could make the argument that if you did a very thorough inspection of the OR air handling system beforehand, whether you would need the spore sampling to be done at that point. But I think this is an example of how you can use that information to really help guide your decisions in when to reopen areas, and two, how to find problem areas and look at them in more detail. And so this is an example. This is data from their abstract where they showed the high spore counts in the operating room, and then they started addressing those, and you can see how they had a nice response. So I'm going to stop there and let Dr. Anucha comment.
ก็มีหลายเรื่องน่าสนใจนะครับก็เขาก็บอกว่าประสบการณ์ที่เขาได้เนี่ยมาจากของดร. เมฮอลนะครับซึ่งมาจาก UTMB แล้วก็สิ่งที่เกิดขึ้นในโรงพยาบาลเขาด้วยเนื่องจากมีน้ำท่วมนะฮะเริ่มจาก1เนี่ย involvement ของ คนที่เกี่ยวข้องหลายๆกลุ่มนะฮะอย่างที่โชว์ในสไลด์ซึ่งก็ตรงไปตรงมานะฮะอันที่2ก็คือต้องprioritize ว่าอะไรจำเป็นในการแก้อย่างเร่งด่วนอย่างเช่นไฟฟ้าเป็นต้นอย่างประสบการณ์ที่เราเจอก็คือเปิดโรงพยาบาลมาปุ๊บก็ต้องปิดตอนบ่ายเพราะว่าไฟมันต้องปั่นมันปั่นไม่ได้นะครับก็ต้องปิดนะเพราะฉะนั้นถ้าก็ต้องเช็ค priority ว่าเปิดได้หรือยังนะครับอันที่3ก็คือการเริ่มประเมินความปลอดภัยนะฮะก็หลายอย่างที่ list ไว้นะครับตั้งแต่ structure ระบบไฟฟ้าระบบน้ำระบบไฟระบบแอร์นะครับสิ่งแรกที่ทำก็คือการ remove น้ำออกอาจจะปั๊มออกแล้วจากนั้นก็ตามด้วย vacuum นะฮะในสิ่งที่ clean ได้อย่างเช่นคาร์เป็ดเป็นต้นแล้วก็มีการกำจัดราทีหลังจากที่เอาน้ำออกอันที่2ก็มีการตรวจซ่อม disinfect นะอุปกรณ์ที่เสียหายไป infrastructure ที่เสียหายไปนะครับอันที่3ก็คือระบบแอร์เนี่ยสำคัญนะครับต้อง make sure ว่าแอร์มันฟิลเตอร์มันทำงานได้จริงๆนะครับเนื่องจากว่าตอนน้ำท่วมอาจจะมีพวกสลัดอาจจะมีพวกโคลนขี้โคลนอะไรเข้ามาทำให้ระบบแอร์มันไม่เวิร์กจะคิดว่าข้างบนไม่เป็นไรนะครับที่เราทำ air sampling ทั้งโรงพยาบาลเนี่ยเป็นทั้งหมดเลยเพราะฉะนั้นข้างล่างมีเชื้อราข้างบนก็มีนั่นแหละมันมาท่อเดียวกันนะเพราะฉะนั้นอย่าคิดว่าข้างล่างเท่านั้นนะฮะต้องคิดถึงระบบที่มันนั่นด้วยเพราะมัน contaminate หมดมีสไลด์ที่เขาบอกชัดเจนเลย if contaminate system turn on มันก็ทั้งโรงพยาบาลนะฮะ can send spore throughout the hospital นะใช่ไหมเพราะเราเป็น central air เรามี air เนี่ยส่งทั่วกระจายทั้งโรงพยาบาลเลยเนี่ยรับรองกรรมเพียบเลยนะครับก็ไม่รู้จะเท่าไหร่นะฮะรับไปไม่รู้กี่ภพกี่ชาตินะครับ UTMB ประสบการณ์ UTMB ก็มีการเปลี่ยนฟิลเตอร์นะครับเป็นฟิลเตอร์ที่สำหรับไซส์1ไมครอนนะครับเพราะเขาเจอเชื้อราเยอะนะครับแล้วก็อันที่2เนี่ยก็เขาเปลี่ยนฟิลเตอร์ทีขึ้นนะครับแทนที่จะเปลี่ยนทุก3เดือนมาเป็น2อาทิตย์เพราะฉะนั้นตรงการ maintenance เนี่ยการเช็คนะครับทิวเทสดูว่าฟิลเตอร์มันดูดแอร์หรือเปล่าเนี่ยหรือฟิลเตอร์มีดูดอากาศหรือเปล่ามีความสำคัญทีนี้คำถามที่เราถามไปตอนเช้าคือ air sampling ทำอย่างไรเมื่อไหร่ควรทำนะอันแรกต้องเข้าใจก่อนว่า air sampling มันไม่ใช่วิธีมาตรฐานมันแปลผลมันไม่มี standard testing protocol อ่ะนี่ก็คือประเด็นสำคัญเพราะฉะนั้นการทำเนี่ยถ้าผอ.หรือใครก็ตามขอดูข้อมูลที่ชัดเจนเนี่ยมันไม่มีแต่ว่าจากประสบการณ์เนี่ยมันมีประสบการณ์จากไหนประสบการณ์จากของดร. เมฮอลเขาบอกว่าเขาใช้ air sampling เนี่ยใน high risk area อย่างเช่น OR คนไข้ area บางคนไข้บาง area ที่เป็นhigh risk นะฮะก็สามารถช่วยทำให้เขาเปิดโรงพยาบาลได้ทยอยเปิดวอร์ดได้ทีละวอร์ดนะครับซึ่งตรงนี้ก็เป็นสิ่งที่น่าสนใจ indication อื่นในการทำ air sampling ก็กรณีการเกิด outbreak กรณีที่เราต้องการ assessเครื่องกรองอากาศว่าทำงานดีหรือเปล่าแล้วก็กรณีที่มีการก่อสร้างเยอะในบริเวณนั้นนะฮะที่คนไข้อยู่ก็เป็น indication 3 indication ใหญ่ๆที่พิจารณาทำด้วยแต่สิ่งหนึ่งที่น่าสนใจคือทำ air sampling แล้วทำไมก็ต้องเอาผลมา implement ไม่ใช่ทำ air sampling เล่นๆเพราะว่าถ้าทำ air sampling แล้วเจอสปอร์เยอะก็หมายความว่าไง1นะฮะอาจจะมี low air flow อาจจะมีการรั่วนะฮะ multiple leak เห็นไหมมีเดบีติดก็ต้องเปลี่ยนท่อต้องเปลี่ยนฟิลเตอร์หรือมีสลัดนะฮะก็ต้องไปเช็ดถูให้ดีแล้วก็เอาสลัดออกนะครับหรือว่าต้องเช็ค air exchange per hour ดูซิ exhaust fan ทำงานได้ดีหรือเปล่าเพราะฉะนั้นการทำ air sampling ไม่ได้ทำเล่นๆนะครับทำต่อเมื่อมี indication แต่ถ้าผู้บริหารถามว่ามีevidence ที่ชัดเจนไหมตอบไม่มีนะฮะเพราะว่ามันไม่มีจริงๆแต่ว่าอย่างที่บอกคือทุกคน struggle แต่เขาก็ใช้ air sampling ทำจะต่างกับ culture environment นะเห็นกราฟหนึ่งน่าสนใจมากที่ UTMB เนี่ยเขาใช้ air sampling สำหรับ fungal air concentration เนี่ยเพื่อในการมอนิเตอร์ความปลอดภัยใน OR แล้วเขาก็ใช้ serial monitor เป็นระยะเลยเห็นไหมนี่น่าสนใจมากนะครับว่าเป็นอะไรที่น่าสนใจแต่ปัญหาคือ access ต่อ air sampling เนี่ยมันคงจะยากนะครับซึ่งตรงนี้ต้องถามผู้เชี่ยวชาญอย่างคุณสุวัฒน์เป็นต้นนะครับ
So, with regards to floodwater categories, we talked about this earlier, but it's important to think about clean water, which is either tap water or rainwater, gray water, which is sink, shower, tub, or washer water, and black water, which is either toilet, sewer, lakes, or river. And so black water, like we said this morning, is contaminated with human or animal waste. and needs both cleaning and disinfection. So you need to, items that are contaminated with black water need to be both cleaned and disinfected. So once you've done the assessment of the building and you think that that the structure is stable and you've gotten rid of the water out of it, then you need to do an inventory of the area with water damage. And that includes looking at the structure, the furniture, the supplies in that area, and the electrical medical equipment. So an inventory of the structure is really just an inspection, repair, or replace drywall, wallboard, ceiling tiles, or flooring that may be damaged. As we discussed before, wet ceiling tiles should be replaced. They're porous, and especially if they were in contact with flood water, they're not going to be able to be cleaned. And then wallpaper must be removed. Then you have to repair, replace, and clean damaged structures. So non-porous material like glass and metal can be cleaned. Semi-porous material like wood, if it's water damaged and warped and rotted, it needs to be removed. This is an example of an upholstery chair that got flood damage, and at this point it was sewer damage, so it would need to be replaced. There's no real way to clean that upholstery. So what furniture can be salvaged? So you should discard wet, porous furniture that can't be dried or disinfected. So that includes particle board furniture. And then disinfect other furniture with non-porous surfaces and salvage it. And then discard upholstered furniture, drapery, or mattresses if they have been underwater or have mold growth or odor. And then discard all items with questionable integrity or mold damage. So what about supplies? So this was an example of, we had a flood in one of our OR areas, and you can see the ceiling tiles are being replaced, and that area is being cleaned. And you can see that they basically have sort of a filter in there, or an air filter, and this is a dehumidifier, and you can see our water collection. And then the nurse is doing an inventory to look for damage to any supplies. So like Dr. Keith said earlier today, discard items if there's any questions about the integrity of the supply or there's been mold exposure. So linen and curtains could be salvaged potentially after adequate laundering. And you could salvage prepackaged supplies in paper wraps if they're not damaged, if they were not exposed to water or extreme moisture, and if they're not in a molded environment. The other thing to think about is drying essential paper files and records, and you may need help from the outside if possible to do that. What we had done in the past, where we dried them and then basically scanned them to a PDF file before disposing of them. This is an example of a flood in one of our pharmacy areas, and you can see it was a minor flood, but you can see that the wallboard has been pulled back to look for water damage, and the supplies in this situation would be safe. So what about electrical medical equipment? Obviously, the first thing is do not connect wet equipment to electricity. That's pretty basic, but something that needs to be emphasized. Visually check motors, wiring, and insulation for damage. Inspect equipment for moisture damage, and then clean and disinfect equipment following manufacturer's instructions. So what about demolition and reconstruction? The goal of demolition and reconstruction are the same as the goal of mold abatement because they're very tied together. It's to protect high-risk patients from invasive mold infections and prevent staff and other patients from dust inhalation. One thing to think about is asbestos, because that can be an issue if there's asbestos insulation and it's being torn up. Methods, you have to assess always plan your demolition and reconstruction. And really it's important for infection prevention to be meeting with the construction people early and often in the in the planning stages. And that includes what's the scope of what work do you need to be done? How much do you need to do? The other thing is it's important to educate both the hospital staff and the construction workers of the risk. We have the problem that the construction workers don't realize that they're just not used to working in a hospital, and realizing that if they tear out drywall and that's moldy and create a big dust plume of spores, that we have patients that are at very high risk of getting invasive infections. So it's helpful to have educational material that's at the level of the construction workers. Gross pictures are sometimes helpful to drive home the point. I've shown pictures of what can happen to a lung with invasive pulmonary aspergillosis, and I think that they see that, and it makes them realize what they're doing. Constructing barriers around the construction site and posting signage, and trying to enforce keeping people out that don't need to be in the construction zone out of the construction zone. Removing high-risk patients from the area as much as possible is important. And then the other thing is establishing pathways for the construction workers in and out of the work site. And you want to try to get it away from staff and patients. So that's why you really need, all of those points are reasons why you should be involved with the construction workers early in the planning stages. Just like I talked about earlier for mold controlling dust and spore spread in a partially open hospital is important. I would say any hospital, but especially if the hospital is functioning. And setting up barriers during demolition to prevent spread to non-infected areas. And that really is the first step in controlling dust and fungal spores. You really need to set up those barriers. And ideally, you should use hard barriers, either plywood or drywall, for long-term projects, though any barriers are better than no barriers. And if you have plastic sheeting and duct tape, that is better than having no barriers at all between the construction work and your patients. You should consider HEPA filters and hard barriers, particularly if you're working in high-risk areas. And I've listed them, especially if they're available. So especially if you have oncology, bone marrow transplant patients, or you're around the ORs. And this is again looking at what a plastic barrier to the ceiling deck looks like. So what about demolition and construction? The other point about this that's important is having proper ventilation in the site. You want to shut off the air vents inside the construction zone if your HVAC system is working, and you want to seal the air grills. So like there, you would seal that so you wouldn't get the potential of dust spreading into the system. You would want to exhaust the air and the dust to the outside if possible. If the air is recirculated, you want to try to use a portable HEPA filter. So that may not be an option. So thinking about how can you exhaust the air out of the construction zone, not into the patient and staff areas. That's the goal that you should be thinking about. And you can use potentially industrial blowers to move airflow away from patients and staff. And then the other thing is, and we saw this in one of the talks earlier, is test airflow to make sure that the flow is going away from patient areas. So you can use smoke sticks, for example, to show is the flow of air in the around the construction zone the right way, and are you getting flow out of the construction zone into patient areas? You also want to control solid debris, especially if you have a partially open facility. If you are using air filters, you should place them in a bag for transportation and disposals, because you don't want the filter that's caked with spores and debris to be sort of spreading it as you walk through the hospital. You want to make sure that it's contained. You want to designate a removal route for solid debris. So again, just like you want a route for the construction workers to come in and out, you want them to know that this is the way you take debris as you're doing your demolition out of the hospital, so they're not going through the open lobby with debris. The other thing that was touched on earlier is you want to try to reduce the amount of dust and spread of dust as you're moving debris out of the construction zone. You can actually have them spray the debris with like water mist to keep the dust down, and cover the disposal cart, the cart that you're using to take it out, before they leave the construction zone. So that way they're not spreading dust through the hospital. And then trying to think about using window chutes to remove large pieces of debris out of the hospital. So that's one way to get it quickly out of the hospital where you're not having dust spread. The other thing is, if you know that they're doing demolition and they're going to be doing a lot of tearing out and there may be generating dust, if possible, and this may not always be feasible, but you should think about trying to schedule debris removal during times when there's less patients and staff around. So you want to, if possible, do this on the nights and weekends when clinics may not be open. The less people around when they're tearing out drywall, the better, because it's less people that are being exposed. So, and this is just an example of a HEPA filter, again, with external exhaust. All right, you should.
ในส่วนต่อไปนะครับเดฟก็บอกว่าพูดถึงเรื่อง flood water category ซึ่งเราก็ทราบในตอนเช้าแล้วของบ้านเราเป็น black water นะครับก็สกปรกมากนะครับแล้วก็มีการเริ่มจาก inventory structure มีการ inspect ก่อนแล้วก็ repair replace clean สิ่งของที่ damage เริ่มจากการตรวจดูทีนี้คำถามต่อไปก็คืออะไรทิ้งได้อะไรเก็บได้นะฮะหลักการที่จับได้ก็คือจริงๆแล้วเนี่ยพวกที่มีรูเฟอร์นิเจอร์ต่างๆที่มีรูทิ้งหมดนะครับที่ไม่มีรูเนี่ยสามารถ disinfect แล้วใช้ใหม่ได้นะครับแต่ว่าอะไรที่สงสัยเกี่ยวกับ integrity แล้วก็เชื้อรามันกินลึกแล้วทิ้งไปเถอะนะครับดีกว่านะครับแล้วอะไรที่สามารถ salvage ได้อันแรกก็ต้องรู้ก่อนว่าให้ทิ้งถ้าอย่างที่บอกอะไรต้องทิ้งเก็บได้ก็คือพวกลินินพวกผ้าม่านซักเก็บได้ก็ต่อเมื่อในที่มี paper wrap ถ้ามันไม่ถูก damage แล้วก็ไม่ได้ถูก damage โดยน้ำเยอะมากไม่ได้ expose ต่อน้ำนานนะครับแล้วก็ไม่ได้อยู่ใน mold environment นะครับนี่สามารถเก็บได้ทีนี้เรื่องของการconstruction การ reconstruction พวกนี้เนี่ยจุดประสงค์ก็คือเราต้องป้องกันคนไข้ high risk นะฮะเพราะฉะนั้นเนี่ยเขามีสเต็ปในการป้องกันคนไข้ high risk นอกจากนั้นยังมีการป้องกันสตาฟเป็นการป้องกันสตาฟด้วยนะสิ่งหนึ่งที่ประเทศไทยไม่ได้สนใจนักก็คือ asbestos เนี่ยมีเรื่องในญี่ปุ่นกับอเมริกานะก็ทำให้เกิดเมโซทีริโอมาพวกเราเนี่ยไม่รู้เรื่องอะไรเราก็ไปสัมผัส environment ใช่ไหมมีเชื้อราเยอะๆมันก็มี asbestos ด้วยบ้านเราก็มี asbestos สิ่งที่เกิดขึ้นคืออะไร20 ปีครับเราเป็นเมโซทีริโอมาอีกประมาณสักเป็น asbestosis อีก10 กว่าปีอย่างเงี้ยมันไม่สามารถโชว์ลิงก์ได้แล้วว่ามันเกิดจากน้ำท่วมแต่เราสัมผัสมาเป็นเวลานานเพราะฉะนั้นนี่ก็สำคัญเป็น area ที่เราไม่ค่อยทราบกันเพราะฉะนั้นบุคลากรเนี่ยมี risk เยอะถ้าเปิดโรงพยาบาลเร็วโดยไม่ได้คำนึงถึงความปลอดภัยทีนี้ในต่างประเทศเนี่ยเขานอกจากเทสพวกเชื้อราเขามีการเทส asbestos มีการสร้างสเต็ปในการคอนเทนอย่างเช่น1 set up barrier เป็นอะไรที่เราไม่ทำนะจริงๆแล้วเนี่ยทำง่ายมากเอาพลาสติกมากันเอาม่านมากันหรืออะไรก็ตามที่เขามีรูปให้เห็นนะครับเป็นสิ่งที่เขาเซตแบรีเออร์ซึ่งตรงนี้มีความสำคัญเพราะว่าถ้าอยู่ในบริเวณที่ลมสามารถเข้าไปคนไข้ high risk ได้เนี่ยต้องพยายามดูดออกอาจจะใช้พวกตัวดูดอากาศอย่างที่เขามีรูป ให้ดูนะครับหรือพัดลมดูดอากาศถ้าเป็นบ้านเราดูดไปในทิศทางที่มันไม่เข้าไปหาคนไข้หรือ HEPA filter ที่เป็น portable ก็ได้นะครับก็มีหลายออปชันให้ท่านผู้ฟังเลือกใช้ตามความเหมาะสมแล้วก็มีการเทสก่อนเนี่ยจะใช้ตัว smoke stick หรือ tilt test เพื่อดูทิศทางว่าจริงๆแล้วเนี่ยตัวที่เราดูดอากาศออกมันเป็นจังทิศทางที่เราต้องการให้ออกไปจากคนไข้หรือเปล่านะฮะจากนั้นก็มีการ control solid debris ด้วยนะครับซึ่งก็มีรายละเอียดซึ่งอันนี้ก็จะเป็นรายละเอียดเกี่ยวกับง่ายๆตรงไปตรงมาไปอ่านได้แล้วก็มีรูปเกี่ยวกับ HEPA filter ของ external exhausted ไปยังข้างนอกนะครับยังที่บริเวณที่ใกล้ๆที่มีคนไข้อยู่นะครับ
So that brings us to you've thought about the structure, you've gotten rid of contaminated equipment, contaminated supplies, and damaged areas. Now to think about really prioritizing what's essential for patient care and how do you reopen facilities. And so I've listed various parts of the hospital that potentially may, and this is a decision that you have to make with hospital administration, with nursing, with the physician staff about what's essential for patient care in your facility. And so I will say though, you can't have an operating room functional if you don't have a way to process sterile equipment. So you really need to think about what are the pieces that I need for each of these areas to work. So if you don't have a functional electric or water supply, basically none of these will really be very functional. So for a laboratory, you need a stable electrical supply and you need some water source, and potentially, as Dr. Anucha pointed out, with the possibility of contamination in the microbiology lab, you really need to make sure that the air system for the microbiology lab is stable and not contaminated. So these are all areas to think about as you recover from flooding and how you get your hospital back to need, and that may be based on local needs. So if you're the surgical referral center for a region, obviously it may be critical that your operating room and your central sterile supply get up to speed before other parts of the hospital. So, but to think about each area of the hospital has special needs to consider, and I sent a handout which you should have, which is a checklist for each area to look at that's helpful to determine if the area is ready to reopen, and it's really based on the CDC's website for flood recovery, and I think it really arose out of their experience with Hurricane Katrina and Hurricane Ike, and how did they get hospitals back to functioning. So I'll give you an example of how do you reopen a laboratory area. So first of all, you think about, can the laboratory testing that you're used to providing in your hospitals be provided? And that I've given examples of whether it's blood gas or electrolytes or hemograms or coagulation studies or basic metabolic studies. Can your lab do that now, or what does it need to get to that point? What do you need to get there? The other thing is, can microbiology or toxicology or serologic testing be performed, or do you have a way to send it out that's reasonable? So that's another thing to think about. The other thing is emergency power available to operate the equipment, particularly in a micro lab, the incubators and the safety systems, and is it able to provide ambient conditions? And what I mean by that is the emergency power there available that you will have the necessary temperature and humidity in the lab, that you won't have high temperature or high humidity that may impact your lab testing? Has all the equipment been inspected for water and humidity damage? Has been repaired, cleaned, and disinfected? have damaged or contaminated reagents and supplies been replaced, and have biological safety cabinets been cleaned, disinfected, and recertified if that's relevant. So you want to make sure that the hoods, if you have a microbiology lab, you want to make sure that the hoods are working and that they are actually functional before you have your microbiology techs. Particularly, you don't want your TB lab to have a non-functional hood and then expose all of your technicians. The other thing is to think about an emergency water supply, and I don't, because of my infamiliarity with sort of the system here in Thailand, I couldn't give a lot of details with this, but I think it's important to just, regardless, to consult with your local water authority, the health department or ministry, or other area hospitals to think about how are you going to get your water supply and will you have enough. And the thing to think about too is really to think about your daily water use for the entire facility. And that's normal water use that you would have used on a regular day. But then think about how much water would you need to do sort of acute care, all functions, and run the HVAC system in the hospital. Or how much would you need to do the things that you consider absolutely critical and also still run the HVAC system. So you might be able to get away with less water supply a day if you target how am I going to use that water. Not all HVAC systems allow this, but some HVAC systems allow you to use non-potable water in the system, and you should talk to your facilities people to see if that's the case for your system, because that may open up possibilities for using other water sources to run the ventilation system. Also, you could use it for flushing toilets if your plumbing is functional. So food services, I think, are critical, and they tend to be overlooked in normal times until you don't have them, and then it suddenly becomes very aware that you need them. And so having a temporary supply of food for staff and patients is really critical until kitchens are recovered. When we had our flooding, both of our kitchens were knocked out, so we had to arrange for an outside vendor to supply patient meals until we could get the kitchens up and running. And a priority for our hospital was not cafeteria seating, obviously. Our priority was we need one of the kitchens to work so we can feed our patients. That was our priority. So, but in the meantime, trying to use outside kitchens or using boxed meals, setting up a temporary cafeteria. This is a picture of a temporary cafeteria from Galveston, Texas. Making sure that you have safe food storage facilities in your temporary area. Is it safe from water damage? Is it safe from vermin or mice or rats? And then also you need hand hygiene facilities for your food service, both preparation and for the people that are going to be eating. So thinking about how do you get your food services, how do you get your cafeteria to work again, there's important issues. Perishable foods obviously should be discarded. And then stored food, both dried and canned food, should be inspected for damage or contamination and discarded if unsafe. Dr. Welchie talked about how if a canned food is not damaged, if they're not dented or they're not expanded and they're intact, how you can potentially clean and disinfect the outside of the can to make it safe for use. You have to make sure that all food contacted surfaces have been cleaned and sanitized. As Dr. Welchie mentioned earlier this morning, wood cutting boards are porous, and if they've been submerged, you cannot get them cleaned and disinfected to a point where they will be reliably safe to use, and you should get rid of them. You should make sure that pest control is in place, and if applicable, that you have local government inspection. So what about now that you've recovered or you're in the process of recovery, what should you be doing as infection prevention and infection control specialists? And really surveillance for nosocomial infections is really critical in the recovery period, both to see if there are issues with your recovery that you didn't anticipate, and also obviously to ensure the safety of our patients. And so active surveillance for healthcare acquired infections related to water or mold contamination should be an important part of your recovery. And so looking for invasive fungal infections due to Aspergillus species or other fungi, looking for non-tuberculous mycobacterium, and looking for Legionella should all be things to think about in the recovery.